I just spent the last hour and a half, almost 2 hours, with Dr. Jim McCarty. And let me tell you, he is one of the best kept secrets for anybody that is experiencing pain in their head, the back of their head, their neck, which, by the way, is most of us. Stress, lack of sleep, just constant pain keeping us up. Dr. Jim, what you do is borderline like unbelievable. I mean, the transformation, the healing, the reduction and or elimination of pain that you've shared with me is absolutely incredible. How long have you been doing this?
I started back in 1985, and then I began adding more and more to my repertoire. And then in 1996, there was a big shift, and that's when the major changes began to happen.
And we're talking about people who have just given up hope on ever curing their constant headaches. I mean, what they describe, or maybe we're told were migraines, and you know, just take some painkillers and do the best you can. There's really nothing we can do. We're talking about people who've been to not just a doctor, who've been to specialists and doctors, possibly all over the country, and have yet to experience any sort of reduction in that pain or any sort of hope that it's ever going to go away. And then they come to you.
Yeah, we've had many people who've been to 17, 24, 36 doctors, even ended up at the Mayo Clinic or Chicago Headache and Neurological Institute and spent a month there and still did not get well.
Wow. And now there's a couple big words that you're about to use that most people may not understand, or I'll tell you what, maybe they've looked it up, and I'm not a fan of, you're probably not a fan of self-diagnosis, but there's some conditions that for whatever reason the medical industry really doesn't diagnose that accurately. Is that correct?
Yes, and most of the time, the people, when they have pain, will go to their primary care physician, their medical doctor, and then, excuse me, he will end up referring them to a neurologist, and then normally they'll do some MRIs and lab work, that sort of thing. And many times, these patients do not respond to the prescription medication, and so the neurologist ends up diagnosing them and telling them that they're making it all up, that they're just pretending, and that they just want attention, that they're depressed. And then they send them to the chronic pain clinic, and the chronic pain clinic is actually run by a psychiatrist or a psychologist. And so it goes into their medical records that they've been diagnosed with depression and they just want attention, and it's all in their head.
See, and the crazy thing about that is sometimes we're talking about like athletes, college athletes, high school athletes, recreational athletes, and sometimes professionals who are just looking to perform, or they've had some kind of trauma in their sport, or I mean, it's all over the NFL and it's all over a lot of these contact sports. This is sometimes caused by trauma. Yes.
Yeah, concussions, injuries to the head, all of these things can set it off. And it's like the straw that broke the camel's back. It's like they say, well, all I did was just bend over and pick up a pencil. Or I think I slept wrong. And they say it's not in my head. I'm not making it up. I just have lost all hope because the medications make me feel like a zombie.
Now, one thing I'm going to ask you for, because you had to show it to me. I was listening to some of your case studies, and I was blown away by what you were able to do without surgery, without radical medication therapies. It was incredible. So Dr. Jim, we kind of need to show them the proof. And I know you've been capturing videos. Oh, here, perfect. Oh, that's awesome the way you just flipped that over. What am I looking at? This is your YouTube channel, right?
Yeah, this is my YouTube channel, and here we have a variety of videos. And some of them are short. They're, 5, 10 minutes, and they're testimonials from the people themselves. And then others are longer. They're more like an hour, and they actually will show me doing the work. So if
Step by
somebody
step through
wanted
the
to come
process.
to the YouTube channel, they could actually look at any of these and see the work that I'm actually doing on people and see it for themselves, or they could, like right here, um, there's a gentleman, Matthew, and he's actually from um, Nashville, Tennessee. And lots of people have been watching his testimonial. And again, there's testimonials, there's videos, interviews talking about TMJ. So all of this right here, the people could spend hours just watching what I'm doing.
But you're the reason it's ours is you're not hiding anything in this process. I mean, this is not surgery. This is not prescription based. We're talking about, physical adjustments. Physical adjustments to their neck, to their spine, to their head. You got some other ways to do it. They can watch it all right there, which, I mean, that's incredible transparency. Now, if they want to work with you, though, and by the way, that's Dr. Jim McCarty, or at Dr. Jim McCarty on YouTube. They can find you at drjimmccarty.com. You got some other websites. We can put all those in the description here so that anyone who's interested can find this. If they want that relief, if they want that pain, if they've been told it wasn't possible, or to give up hope on it, or that there was something wrong with them, not physically but mentally wrong with them, which, by the way, that's it's unbelievable how you can go through. People think you're making this stuff up, okay, fine. If they want to work with you, they typically will come down. You're in Dallas. I see Dallas behind you. I'm assuming you're in Dallas. They come down and visit with you, yes?
Yeah, they can give me a call and we can talk about their particular situation and do a case history over the telephone. Okay. And then we could schedule for them to come in and get some treatment.
And I realize everyone wanting the quick fix or wanting this is not telehealth here. You will talk to them to diagnose them and see if you can help them. And if you believe you can help them, then they're going to get on a plane and come see you in Dallas. Yes.
That's correct.
Yeah. And I want to be clear about this because, that's not a negative thing. This is not something you're not healing them over the internet or to that purpose. You have a actual, and they can watch it because you have it documented there, exactly what they're going to go through. And they spend probably we're not talking about a half-hour appointment. They got to schedule out a few days of their life to come do this, but they've been absolutely wrecked by pain up to this point. So imagine the relief. Imagine how it's going to feel when that pain is gone. And not gone because you're giving drugs to tell your body that it doesn't exist, but because it's actually addressed. Yes?
Yeah, it's actually a process, and sometimes the results happen in 15, 20 minutes. Okay, there's a lot of the videos that we have over here on the YouTube channel and we'll be having more very shortly. Some of these that I've put up just recently, the results began to happen in less than an hour. But there are other people that are going to need more time, kind of like I don't do braces, but at the same time, the analogy is it's a process and it could take 4 to 6 months. But when the people come to see me, they will come and they will spend a week. They'll spend 4 days. And then I'll do the exam, the evaluation, and then that's to help me find what's wrong with them and then go ahead and then start fixing it. Find it, fix it, help them get more focus in their brain. And we're actually moving the spinal fluid to get the spinal fluid to hydrate the brain. So we get rid of the dehydration that's caused by concussions and inflammation.
And that's the part that's not really talked about or discussed is hydration.
And there's nobody else that's actually doing the work that I'm doing. We're going to be, in the next year, we're going to start training other doctors, but at this particular point, over half of the patients that I have are coming from out of state and from other countries. We have people from Turkey, Croatia, England, United Kingdom, all the way from Australia, from all the provinces in Canada, and most of the states.
So you'll be building a network so they don't need to travel as far. But right now we're talking about the people who have the pain, who have the migraines, who have.
Right now they're having to talk to me and then actually come and spend 4 days with me here in Dallas.
Okay.
And then they go back home for a month, and then they come back for 4 days. And so most of the people need to come for about 6 months.
Gotcha. Okay. Back and forth. And I, by the way, I appreciate the time you've given me, Dr. Jim, because like I said, we were working on a couple things off to the side here. I got super interested because of the power of those testimonials, because the power of those people you had that experience and that you had the foresight to capture and the willingness to share the transparency with us of exactly what you do. Dr. Jim, I can't wait to see where you take this with physicians, chiropractors, and those that you will have the ability to train in the future here. But even for right now, the transformation, the alleviation of the pain, the back to a normal life after being told by doctor after doctor that this was just something they had to live with or something they were making up, that's what caught me. So I hope people take the time to watch this. We're only doing about 10, 15 minutes here. This is just really, and man, I was just so impressed. I wanted to get this out, Dr. Jim. So they can find you at Dr. Jim McCarty on YouTube. Is it drmccarty.com? We'll put all those links in the description here when we post this out so they can find you. But Dr. Jim, I know you're busy. I can see your patients trying to get to you via email there. But I appreciate the time today. Thank you very much.
Thank you very much.